Today my supervisors asked me to perform a health check and to give a worming tablet to Roxy here. Now, Roxy's a chocolate Labrador and she's about 7 years old. She's a pretty large dog for her age and breed, but as you can see, she's a pretty happy and relaxed dog. Now, from our initial distant review, she doesn't seem to have any obvious physical or medical issues, although she does seem to be pretty overweight, and on a hot day like today, it could be causing her some breathing issues. As you can see, she's breathing pretty heavily, panting. And just before we start moving her inside to do our health exam, we're just going to gather all the items that we're going to be needing for the task. So that'll be our gloves, mask, paper towel, disinfectant, and a lead and a notepad just to take down any observations. So now we're going to go back out and we're going to use the lead to transport Roxy inside to our exam room. And because she's a pretty large dog, we're not going to worry about placing her on a table. We're just going to complete the examination on the ground. Just before we start the assessment, we're just going to put on our gloves and our mask just to prevent the risk of any zoonotic diseases being contracted here. And we're just going to start off by first checking for any discharge or any abnormalities coming from her eyes, her ears, nose or mouth. And everything seems to be good. Her eyes are nice and clear and bright. Her ears are nice and clean. No discharge or any mucus in her nose. And her mouth is also nice and clean with no excessive tartar built up. And just whilst we're checking her mouth, we can go ahead and check her mucous membrane color. We can see it's nice and pink and moist. And we can also, whilst we're here, just do a capillary refill time, which seems to be pretty healthy, no more than 2 seconds. Now we're going to stand her up and we're going to assess her body score. And she's pretty large. I would probably say she's about a 4.5 to 5 out of 5. Meaning she is pretty obese. And now we're just going to perform a hydration assessment on her, just by simply pinching a bit of skin on the back of her neck and just seeing how long it takes for that to drop. And as we can see here, it takes about 2 seconds for it to drop, but it is completely fine. She seems to be pretty well hydrated. Now we can move on to finding the femoral pulse and assessing her circulation. So once we found that, we can just hold for about 15 seconds, just counting each beat. And then we can times that number by 4, and then we should get the beats per minute. So we're just going to start when the clock hits 12, and then we should be good when the clock hits 3. And the beats in that 15-second period was about 23 beats, so that should be about 69 beats per minute. So now we're going to move on to assessing her respiration. So for that, we're going to be counting each breath within a short 15-second period, and then we can just multiply that result by 4, and we should be able to get her breaths per minute from that there. Now at the moment, Roxy is pretty excitable, so unfortunately we're unable to get her proper resting breath per minute rate, as she is slightly panting at the moment. However, we're still able to do this assessment, and we're just going to start from when the clock hits 6, so we should be good when the clock hits 9, and the number of breaths within that period is 22, so meaning she has a breath per minute rate of 88. So now that we're done with her health assessment, we can give her her worming tablet. So we're just going to start by placing our fingers on the side of her jaw, and just lightly pushing just to open up her mouth. Then place the worming tablet in the back of her throat, and then just close her mouth and just rub her throat until the worming tablet goes down. And now that we've finished up with the health assessment and giving her her worming tablet, we're just going to take Roxy by the lead and bring her back outside. And then we can start cleaning up our workspace. So we're just going to grab a bowl of warm soapy water and then F10 in our paper towel. And we're just going to start by dipping our paper towel in the warm soapy water, just rinsing down the workspace. And then we'll grab our F10 and just spray down the area and wipe that too.